Good morning, ladies and gentlemen. This is your host, Sandeep Vednikar, and you're listening to One Universe, the show based on a nonprofit that fosters positivity through the promotion of love, peace, and harmony. And to foster and promote that, we have two wonderful people here talking about the impact that they do in the county with their work, not because they're forced to, but because they love it. So, can you please introduce yourselves?
Go ahead.
Sandy?
Oh, you wanna go? Okay. Sandy Bromley. I am the Deputy Director of the Division of Community Services. I'm one of two Deputy Directors, and I oversee all of our justice programming.
Okay.
And good morning or afternoon. I am Cherry Whitehead Thompson, Deputy Director for the Division of Community Services, and I oversee all of the social services and housing programs.
Okay, perfect. So, we have talked to the director, and she has given an overarching view. But we would like to get into the nitty-gritties of each of your departments. So, Sandy,
Sure.
please tell us about what you do.
Absolutely. So we, you know, I oversee, like I said, all justice programs. And so every one of our programs somehow touches the justice system. However, we have a different framework than being within the criminal justice system.
Mhm.
And so our justice is really around community well-being, right? And making sure that folks, that are justice involved, so people that have committed some sort of crime, through our pretrial services and our behavioral health services, they will try to find some alternatives to incarceration. Maybe a program is better for that person than being incarcerated. Maybe, frankly, maybe it's just resources, connecting them to being able to pay their rent and then them not stealing anymore, whatever it may be.
So we are not just talking about victims.
Correct. This is for offenders of crime,
Mhm.
and really, how can we wrap them around with services, whether it's mental health services, behavioral health, whether it's resources, whether, like I said, it's programming like a batterers intervention program, something to keep them from committing future crimes, right? We want to keep them, one, out of jail, but then two, we want them to stop doing the crime. So that's one side of things.
Mhm.
And then we also serve victims of crime through the Crime Victims and Rape Crisis Center. That's a comprehensive victim service center. They serve over 4,000 victims of crime every year.
Mhm.
And we know that that's not even putting a dent into the number of victims that are out in our community. And so we're doing a lot more work around community engagement as well through our Crime Victims and Rape Crisis Center, including violence prevention programming as well in the schools, in our community, making sure that we're talking about trauma
Mhm.
and the impact that trauma has on our brains and our behavior. So that's CVRCC. And then we have the Youth and Family Resource Center,
Mhm.
and that's a youth justice diversion program. So youth who commit really low-level crimes, right? I say stupid stuff. So curfew, trespassing, sometimes simple assault, but it's just like, you push somebody in a cafeteria, that kind of thing. They are referred to us, and we provide that young person and their family with a comprehensive assessment. We identify their needs, but we also identify their strengths, which is really important. We've got to start talking more about the strengths in our community, which we have a lot of,
Mhm.
and really trying to have families capitalize and grow their strengths to help overcome some of their needs. And so we every person leaves the YFRC with an individualized action plan.
Mhm.
And then our youth advocates follow up with that family as they go. And that does keep them out of the youth justice system, so that we know when you start touching the justice system, they're more likely to keep going down that road, unfortunately. So we want to never have them even touch the system. I think that's about it.
Okay, all right. And I also initially my thing was to also ask you to introduce yourself in terms of you as a person and as an individual. So let us start with you first.
Oh, so me. Well, I am a social worker by trade and one who I think has a heart for the community, which is
And born and raised
born and raised right here in Memphis,
Mhm.
which is hard for some people to believe, but yeah, I have been here all of my life. And it's just important to me that the work that I do does actually impact people's lives in a positive way.
Mhm.
And so that's why I think most of my career has always been around social services in some form or fashion. Yeah.
Okay. And you, Sandy. Yeah.
So I'm an attorney by trade,
Mhm.
but don't hold that against me. Most of my staff say, "Well, you're more like a social worker." And I was like, "Yeah." But my entire career has been working with victims of crime in some capacity, people impacted by really horrific things in their lives. And yet, one of the things that I love about my job and love about the work that I've done over the years is the strength and the capacity to heal even after those really horrific things. Resilience is a thing; it's possible.
It is.
And so, and it just makes folks stronger, right? And so it's just amazing to watch people go through that journey, even after something that was intentionally done to them to no fault of their own, and to see them go through the journey of healing towards hope is just really powerful.
Okay. So now let us talk about your department.
Yeah, so social services and housing, anything related to supports that people need. So we do serve all of Shelby County, Memphis and Shelby County. There is Community Services Agency that most people know in the community as CSA. What they're known for basically is being a crisis type intervention program to help individuals who need assistance with rent or utilities or mortgages to basically keep them housed and their utility services connected. They also have a social service program or a self-sufficiency model that is geared to help move people from poverty to more of an economically stable environment. There is a medical prescription program as well for those who are either uninsured or underinsured and need assistance with receiving supports for medications. So CSA covers all of that.
And that is not related to age.
No, no. So basically, not the programs are income based, so they have to be a Shelby County resident and meet the income criteria.
Mm-hmm.
But other than that, I mean, if you have, for example, with the utility support, if you have an active utility account and just need help, you don't have to necessarily be disconnected or on the verge of disconnection, but just need help with your utility support, then they can provide help in that way. There's also veteran services, and those individuals, the veteran services officers, are responsible for assisting families as well as veterans with filing claims and just ensuring that they get all the benefits that they need and are eligible for as veterans. And there is the Aging Commission of the Mid-South. They focus on those who are seniors and with disabilities to make sure that they have those support services that they need to try to stay in their homes. That's the goal there, to keep them in their homes. So I think those, and then there's the Emergency Rental Assistance Program, or I guess Emergency Housing Support Program, that works to just with individuals who are on the verge of eviction. They may have an actual court date to be evicted, and so they work to just try to assist those individuals with the back rent that may be owed to the landlord, and pay that out to keep them housed, and then possibly even paying the first couple months as well forward to keep them stabilized in their housing.
And this was a major crisis during COVID.
Absolutely.
Did this start before COVID? Or
Well, so the Community Services Agency or CSA program was in place before COVID. It's been in place for about maybe 35, almost 40 years.
only?
Yes, only.
Yeah.
And then with the Emergency Rental Assistance Program, that was, as we call it, the COVID dollars that came down to many of the communities. So there's still some residual funds left in that space. And so we're working to just, again, spend the rest of those dollars and just try to help people stay housed who are going through eviction.
So she mentioned a number of 4,000 people who are being assisted. And it is on the addend because there is a whole lot more. What are your numbers? How many are being assisted in various sections?
Yeah, so I would say for Community Services Agency in particular, that's probably the highest volume of customers served, and it's probably between 25 and 30,000 individuals a year as relates to, and most of those are for utility support because it's just, I don't know, if you look at just what's happening right now, people still have not recovered from just the impacts of COVID. We know that many of the issues were already there before COVID kicked in, and it just exacerbated it once COVID came on the scene. And so people just have not seemed to recover. There's still a high need for utility support. There's still a high need because, again, the cost of living has gone up quite a bit too. And people's expenses are just outpacing their revenue. And so we just do what we can to try to make sure that they, again, stay connected and stay housed.
Okay. So Sandy, you and I serve on the Sexual and Domestic Violence Task Force for the city and county. And we talk about a whole lot of things, not because we need to talk, but there are the problems that really exist. in our community, and we are addressing those. So can you address some of those issues?
Sure. So I think, right now a lot of conversation and attention is being put towards community violence in general, particularly community violence with firearms. And that's really important. That's obviously been escalating quite a bit. And we want to make sure we really address crime holistically, make sure we start really talking more about prevention and early intervention and not just waiting for folks to commit these crimes. That's one thing. But I think one of the things that we don't talk about enough as a community is some of the root causes of that violence, and some of the violence that really precipitates community violence is violence behind closed doors, and that's domestic and sexual violence. That's oftentimes, when you look at some of these offenders that are committing murders in the streets, they're often committing crime at home first. And so I think we really need to start talking a lot more about domestic and sexual violence. How can we better intervene early so that these offenders don't continue to hurt people?
Is there a number or a percentage? Has there been a research done as to that? That is what it starts with and then escalates into the streets.
Sure. Forgive me, I don't have the numbers quite off the top of my head, but I want to say regarding mass shooters in particular, I want to say something like at least 25% of them also have prior domestic violence charges before conducting the mass shooting. And so, there's that connection. And I think, honestly, the numbers are probably much higher. We're talking about reported domestic violence, which, only about a quarter of domestic violence is reported anyway.
So when we are talking about violence out in the community, what do you see more? Is it still youth or grown-up adults who are committing these crimes?
The vast majority of the crime is committed by adults, right? It's about 90% of all of our crime is the violent crime is committed by adults. We hear about the youth cases a lot more, and it certainly has gone up a little bit over the last 3 or 4 years. However, we have to remember that that's not the majority of the crime. It's just the cases we hear about more. I think we're more surprised by it. We're more likely to repeat it. The news are more likely to air it on the very first story of the day.
Yeah.
And so we think that youth crime is really out of control, and we really have to remember it's not necessarily all youth.
Yeah.
True. For the issues that you handle, what are you have mentioned it, but still, can you highlight some of those issues that are like burning from your perspective?
Yeah, I think just where people stand economically is a problem. A lot of it could stem and does stem from just the education system. Individuals that may not necessarily have everything they need to be successful going forward. And so it all ties, right? If you, for example, if you don't have a high school diploma, which is kind of, we count that as like the basic, the bare minimum. If you don't have that, then the number of jobs that could potentially pay a livable wage are limited for you, right? And so you have individuals that are working more than one job, just trying to make ends meet because educationally they don't have what they need to go after those jobs that make more money. And so there are job opportunities and there are job training programs available, but many times it's based on the operation, daily operation of the agency. And so many times people don't necessarily have, for example, if I'm working, let's just say 8 to 4 or 8 to 5 somewhere, and that's the time that your program is open and there's nothing after hours to help support me, then I can't necessarily be a part of the program. So there are a lot of different, problems that tie into it. So it's the education, it's finding jobs that have a livable wage that can actually cover the cost of the expenses that you have. And so that's why a lot of these programs that we provide are necessary, because we have a lot of people who are actually working, but they just don't make enough to make ends meet.
Right.
And so when you're talking about, a household where there may be, small children involved, there are a lot of families where there's a grandmother and grandfather living there, 3-generation households. And so the income, again, just doesn't outpace the revenue.
Right.
Well, the expenses, rather.
Right. So that leads me to the next question for both of you, is that we know we are having these issues. We are fighting those things, these challenges. What is being done through your departments to just reduce, minimize, not necessarily make them disappear all of a
Yeah.
sudden, because it's not going to, at least not overnight. But what are the remedies that you are implementing in both of your departments uh, to let those problems go away?
Sure. So I think one of the things that all of the programs under justice programs really hits on, that's probably not the right word to use, really focuses on
Mhm.
is trauma, right? If we can heal folks from their histories of trauma, most people are bringing with them a lot of baggage, whether it's generational trauma, whether it's historical trauma, the still everlasting effects of racism in this country. There's lots of trauma that folks have had to deal with. And so whether or not we're trying to get some trauma counseling to an offender who's committed a crime for the first
Mhm.
time in his life, and we want to say, hey, let's understand your behavior a little bit better. Let's unpack that and let's try to get to some healing so that we don't do that. We don't repeat that behavior again. Or it's in victim services where, sometimes I say for a crisis center, it's almost like we're putting a Band-Aid on a bullet hole, right? But we have to start talking a lot deeper about that underlying trauma, because it's not just the gunshot that brought them into our center. It's the gunshot on top of poverty, on top of oppression, and on top of that trauma. And so we've got to be a lot more holistic. And so we're trying. And what's important about our programs is our partners in our community, right? We know that as government, we can't do it all.
Mhm.
We absolutely cannot do it all. We have so many nonprofit organizations in this community.
Yeah.
Let's take advantage of them.
Mhm.
Let's make them put their money where their mouth is, right? Make sure that they're living by their mission and they're serving people appropriately. And so we're constantly doing community engagement to make sure that we're connecting with those partners and make sure we're reducing barriers for our clients to get there, or to get to us for that matter. I mean,
Right.
one of the things that we deal with a lot is that there are a lot of resources in this community.
Mhm.
Lots of cool events and that kind of stuff. And yet sometimes we might have an event. For example, we recently had a youth trauma workshop called Champions, and we had 3 kids. And I just thought, oh my gosh, this is about youth trauma. And everyone says we have so many issues around this. And we had
And
3
there's-
kids show up, And so how can we reduce the barriers and do things differently
Mhm.
to actually reach people?
Yeah, and I
And-
think it's all about awareness and accessibility, right?
Yeah.
Because, and I think within our division, we are doing a pretty good job, I think, of trying to get information out to the community. We have a department that actually focuses on that 100%. We do a lot of outreach. And Sandy mentioned trauma and strengths-based perspectives. I just think the whole division as a whole is what we do. That's kind of what we do, we focus on. Because as she stated, although she's talking about justice programs and trauma, some of the same people that
Apply
her
to-
programs work with are coming through the social services side
Yeah.
departments as well. And so again, just trying to identify what those areas of need are, and because you don't want the recidivism, you don't want them coming back year
Mhm.
after year for the same supports. Let's talk about how do we help you develop a foundation that will catapult you into a space of self-sufficiency so that you are able to make a livable wage, manage your household, and not necessarily have to come through these social service programs for support each year.
Right.
So,
And
yeah.
I also want to highlight that whenever you go to the news channel and you talk about the services that you offered, and there is a small glimpse of what is being offered, the time and information. And our show is one that is here to promote all the good things that you're doing. So we want to see to it that our listeners have access to all the things that are available through the county. Um, so as we come towards the end of the show, and I also want to mention that there are a whole lot of things that we want to discuss and we do not have enough time. So we are going to do several interviews. I'm saying this on air so that we come here and highlight each and every single thing that is available for the citizen of Shelby County. But at least for now, if you can, please mention the numbers that they can call to reach out. And I know we have the website, so mention that as well. But the numbers that people can reach out to.
Sure. So the very easiest thing to do and remember is our main line, and that's 222-3990.
And which is area code 901.
901
901
222 3990. Yep. And then that person, whoever answers that, that's our main line here
Mhm.
downtown. But that person can connect you to all of our departments. You don't have to remember all of them.
Yeah, because there's like 9 departments. So
Okay, so
and the
please,
website.
and the website Shelby County Tennessee.gov.
.gov. Yep, exactly.
So please mention the 9 departments.
What do you want to start with the justice side?
Sure. So on the justice side, we've got pretrial services,
Mhm.
behavioral health services.
Mhm.
Those were, again, both for offenders of crime. Crime Victims and Rape Crisis Center.
Mhm.
We've got the Youth and Family Resource Center.
Mhm.
Is there anyone else under me?
I'm thinking about Kim's group. So the
Community engagement and outreach.
Yes,
So
that's
there's
5.
5.
Mhm.
And then on my side is Community Services Agency, or CSA,
Mhm.
Veteran Services, Area on Aging, and then also the, again, I'll just say ERA programs, the Emergency Renewal Assistance Programs. So that's the 9.
Yep. Good
Yeah.
job.
So when
We
it
remembered
comes
our
to,
own programs. That's good.
yeah, see?
There's a lot going on though.
Because I think like, well, how many do we? Okay.
Well, because we
Yeah.
have little projects here and there on
Yeah.
top of
See,
our
all over.
so many
departments. Those
things
are just
going
our
on
major
at the same
departments.
time. I
Yeah.
understand. When it comes to housing, how is housing offered to the county?
Well, so that is really a difficult one.
Okay.
When I talked about the ERA program and trying to prevent eviction for people who are in the eviction court process, there are relationships that we've developed with landlords who are kind of like the second chance landlords. They're willing to help folks that may have some past judgments, because what we're finding is that landlords are asking for 3 times the rent upfront. That makes it very difficult for people who, again, are living in poverty and don't have the means to do that. And some of the people we qualify them as hard to place because, again, they have past judgments. They don't make enough money to actually secure a lease.
Mhm.
But we have been able, in some cases, not all, but we have been in some cases able to support them through the relationships that we've developed with some of the major landlords throughout the city. And we're even working to try to get in touch with more of the mom and pop landlords as well that have like maybe duplexes that they want to rent out. We do work with Memphis Housing Authority. We work with many of the community development corporations within the city, United Housing, Habitat for Humanity, to just try to help get people set up, because those programs, in particular the community development corporations, do target individuals who are the lower income spectrum to try to help them get housed. And many of them have like first-time home buyer classes that will help them to understand what it means to be a homeowner, because for a person who may have never lived in a home or owned a home, there are things that you need to consider and all the expenses that go along, because you can't necessarily call the maintenance crew when you have a toilet issue, and that becomes your responsibility. So I think it's just kind of working with the partners throughout the community to just try to help get people set up. And again, if we have landlords that are willing to take payments, because there are some that don't necessarily want to work with government, and they will tell you that it's like, we don't want to deal with that. Too many strings attached. At least they think that there are. And so many a times when we have people who are in eviction court, the landlords are willing to work with us, and we will help to pay, again, what the client owes. And then sometimes if the funding is available, support them a couple of months in advance to just make sure that they're able to get stabilized.
Okay. So, ladies and gentlemen, as you heard, there is a solution for your problems. If you are not in a situation where you need help, you might know somebody who needs help. So please reach out to them. The number to call is 901-222-6990. And the website is shelbycountytennessee.gov. And you can also reach out to us at sgp97@hotmail.com or call us at 901-849-DEEP. That is 849-3337. So thank you, ladies. Thank you so much.
We want to clarify one that phone
please.
number. So it's 901-222-3990.
39, not
Yes.
69.
No problem.
I stand corrected.
Yeah.
So 3990. Please make a note of that number and harass them.
Give us a call for sure.
They are here to help you. They have helped. And I have worked with Sandy as well. And I have worked with the department over 2 decades with different mayors and administration. So thank you for the service that you offered to the citizens of Shelby County. Thank you so much.
Well, thank you for having us and raising awareness for sure.
Yes. And I also want to say that I want to go in depth with each of the 9 semi-departments that you have. and so that we can disseminate that information to our people.
Love to
Perfect.
do it. Love to do it.
Great.
Yep.
So thank you so much. Until next time, have a great time. And when you tune into our show, know that we are going to talk about something really positive that promotes love, peace, and harmony. Thank you so much and have a great day.
Thank you, Sandy.
Thank you.
Thank you.
Bye bye.